Your body has more than one clotting factor, but if one is taken out, it's like dominoes. Like if you pull one out of the middle, it stops the rest of them from working. And so with the most common type of hemophilia is hemophilia A, which is a factor 8 deficiency. So the eighth factor is just gone in the worst cases, and that makes it so no clotting happens whatsoever. And so like in this situation with a severe hemophiliac like my brother, his blood he wouldn't stop bleeding. But that's like the question of getting cut and will it stop bleeding? That's like the question that everyone asks, and it's kind of funny for us when we know about when we know about how hemophilia works, because like, I mean, a cut on the hand isn't deep and it's not gonna like give you really a big problem, especially if you are injecting factor back into your blood, like my brother does every day. But like theoretically it wouldn't stop, but the fact that we have medicine regularly available means that it'll be fine, you know. The main problem is with more traumatic bleeding or deeper injuries and things like that, especially internal bleeding, that could be more fatal, or bleeding in the joints that would damage tissues. Those are the things that are more harmful to a hemophiliac and what we're trying to avoid. Just for like a skin abrasion, like a small cut or something, it would be kind of like when you cut yourself shaving, how it doesn't stop and it just keeps going. That's kind of what it's like. And I'm not sure. I really don't think it would stop if you didn't have any factor at all. But I mean, we haven't really ever tested that. Don't really, you know, but even with a small cut like that, your body would probably keep generating blood at a faster rate than you're losing it. And it wouldn't be like a fatal injury, you know, like a paper cut or something isn't gonna kill you if your blood doesn't clot. I know there's at least, I want to say there's at least 10, maybe 12 or 13 clotting factors. And then there's a couple others with different names that help with the clotting process too. But basically they're proteins. And so the first one finds the cut or whatever is bleeding, and it attaches and signals to the other ones, so that they build on top of each other to form the clot to stop your blood from leaving your body or, you know, making a mess in there. And so they kind of build on each other, and you need each one in order for the clot to form. Otherwise, it just breaks down again. So if you get like 1, 2, 3, 4 all the way up to 7, and then you're waiting for 8 and it never shows up, then the clotting just stops there, basically. So basically, they're just proteins that build off of each other. Yeah, and then some cases, like really rare cases, I believe you can be missing factor 5, or like very rarely it could be a different one. The most common is 8 and the second most common is 9. So